The first myth about sexual assault exam is that I have all the control. All the control is in your court. If you decide that you need to take a break, or you have a question about what it is I'm doing, you're the person who has all the control about how this exam goes. So if you need it to stop, or you have a question about what it is that I'm doing, it's absolutely fine to say, I need to stop right now. I need to stop for a few minutes, or I need to stop for half an hour.
Tell us what happened to you. Tell us from where you think you should start talking until where you think you need to stop. And then we'll work together to decide how we can help you. We can do an evidence collection, and that does not mean that you need to report the assault. We can do the evidence collection, and the state will save the evidence, and it can be used later if necessary. Or we cannot do evidence collection. We always took care of victims in the past, usually collaborating with a physician in order to do the examinations, collect evidence, and treat the victims. But now the nurse has the training to do the whole exam independently.
I am an evidence collector, but I am also a nurse. So I am assessing a person for injury and pain. I am collecting forensic samples. I am assessing vital signs, and I am providing follow-up. So I am doing the job that I've always done as a nurse and doing the things that I continue to train for as a forensic nurse. There's a big team out in the world past the emergency department. It involves sexual assault crisis centers in our area. That center is called Hope Works. There's also law enforcement teams that don't necessarily look like your generic police officer. There's also therapists, and the therapist can be of your choosing, supported by federal monies.
There are many different circumstances that you may not even necessarily think of as sexual assault, and maybe you need help talking through that with someone. Just come to the emergency room. You'll speak to the triage nurse first, tell them what you need, and she will put you in a private place and can call an advocate for you, and she'll call one of the nurses who are trained, and will come and speak to you and help you figure out what you need to do next.